Hello, my name is Jackie Orton. I'm a student of Western New Mexico University in beautiful Silver City, New Mexico. I'm conducting a proposed pharmacological treatment for medication treating diabetes mellitus, which is for either type 1 or type 2 diabetics. The proposed treatment is to include lisinopril, which is a generic for Prinavil. It is being prescribed for a patient who has recently been diagnosed with diabetes type 2, high blood pressure, and high cholesterol, and is overweight. These factors increase the patient's risk for heart complications. Lisinopril should reduce the vascular blood pressure known as hypertension, which will further assist in reducing damage to the client's kidneys. The pharmacological treatment is that lisinopril is in low dosage and is an effective treatment to reduce high blood pressure. A person with diabetes has elevated blood sugar, and that puts added stress on the kidneys as the organs attempt to eliminate the sugar from the body. In untreated diabetic patients, sugar remains in the bloodstream instead of providing cellular energy. Damage to one's kidneys takes place when extensive amounts of urine flow into the kidneys, and this is called proteinuria. Other types of kidney disease unrelated to diabetes or high blood pressure can also cause protein to leak into the urine. Vascular pressure increases, causing renal hypertension, which damages the fragile capillaries that provide the filtering action. The capillary damage, or nephropathy, minimizes filtering ability, allowing blood and proteins that normally remain in the body to flow into urine. As renal pressure increases, further kidney damage can occur. When having high cholesterol, these patients have a greater chance of developing high blood pressure known as hypertension. This can cause coronary heart disease, which is why ACE inhibitors, hence lisinopril, are recommended. Prescription requirements begin usually at 10 milligrams, and you just take it one time daily. You might ask, what are the benefits of adding an ACE inhibitor? Well, the rationale is that lisinopril is used in patients who have diabetes, of course, and they have high blood sugar levels, so the high blood pressure can cause damage to the person's kidneys. Therefore, it is important to take lisinopril when being treated for diabetes because diabetic patients need additional protection for the vascular pressure that can build up in their kidneys. As I stated, there is a direct link to conditions associated such as high blood pressure in patients diagnosed with diabetes, whether it is type 1 or type 2. And this is known as hypertension. So adding the ACE inhibitor is possibly effective. Now, the relevance to the treatment plan is that because lisinopril belongs to the class of ACE inhibitors, the medication inhibits the enzyme that initiates the conversion of angiotensin 1 into angiotensin 2, therefore helping to prevent kidney damage associated with the hypertension that most patients have when they are diagnosed with diabetes. In addition to the association of lisinopril and diabetes, the ACE inhibitor can be prescribed alone or in combination with other medications for the treatment of general hypertension as well. When heart failure patients do not adequately improve while using other medications, sometimes physicians may even add lisinopril to their treatment regimen. Now, the medication class for lisinopril, as I stated, is an ACE inhibitor, and that is called an angiotensin converting enzyme. And this is an antihypertensive medication. Its functioning includes that the medication inhibits the enzyme that initiates the conversion of angiotensin 1 into angiotensin 2. And since renal blood pressure often rises in diabetic patients, lisinopril can help to reduce or may even block the vascular constriction, which overall reduces blood pressure and prevents kidney damage from hypertension. Also, other uses of lisinopril include improving the symptoms associated with congestive heart failure. Lisinopril may help reduce these risks associated with the high blood pressure, fatal or even non-fatal heart attacks, or any other complications that can lead to heart failure, or any other hospitalizations needing other surgeries or procedures to increase the blood flow to the patient's heart muscle, and may also delay the progression of the potentiating kidney disease. Some side effects are dizziness and headaches, dry cough, and diarrhea. Some patients are known to develop swelling in their face, tongue, or lips, known as angioedema. These conditions could be life-threatening but are rare. Some risks are that patients having increased potassium levels or an increased risk of infection, these can cause interference with the white blood cells when there is the risk of infection. So lisinopril may interfere with that, and this is only in certain individuals. My role in supporting the client through the trial of lisinopril will be to monitor any patient complications, such as dizziness or headaches, and to have the patient report additional complications, such as swelling underneath the skin or any constrictions due to the thorax or breathing or anything like that associated with taking the medication. My patient will be monitored further by testing himself continually on a daily basis to reduce his blood sugar levels, and will be monitored with a thorough maintenance of diet and an exercise program to reduce the sugar levels. The diet and the exercise program are essential to the control of the diabetes and the hypertension as well. And the patient will also go on a low salt diet. I will make sure that his HbA1c target levels are where the patient and I have agreed they should be. I will encourage him to self-monitor his blood pressure while he is at home and suggest yoga and transcendental meditation, which has been shown to be an effective non-pharmacological treatment to reduce stress, thus lowering his blood pressure. Hopefully, this treatment and following my recommendations, my patient will gain positive momentum of health. Thank you.